we're inviting Dr. Prateep Vyas. Dr. Prateep Vyas, who's a former Secretary of Glaucoma Society of India and has many years of experience in all types of glaucoma. And I invite him now to tell us about the studies and what they say about the efficacy of lens extraction in PACG. Prateep.
Thank you, Dr. Vinay, for this opportunity. Good morning, friends. I would be talking on what literature says about the clear lens extraction or lens extraction in angle closure glaucoma. Unfortunately, we do not have a robust literature available which can prove that the lens extraction is beneficial in angle closure disease, but still it's my responsibility to share whatsoever I have learned from the peer-reviewed articles. So this is the classification of angle closure disease, and the first is the angle closure suspect, where obviously the role of lens extraction is not there. So I will try to take out some studies which addresses the role of lens extraction in primary angle closure glaucoma, acute angle closure disease, and chronic angle closure glaucoma. I will quote one disease for each one of them. Okay, so this is the basic science behind what we think that the lens extraction might be beneficial in the angle closure disease. Once you take out the lens, then there is an increase in the AC depth, increase in AC volume, increase in angle opening distance. So there is a less crowding at the angle. So aqueous can egress out of the eye freely and the intraocular pressure goes down. There is only single landmark trial is available in the literature as of today, which also might be having lots of drawback, but I am not here to do the critical appraisal of any trial. I will just let you know what the trial says. The first is the Eagle trial, that is effectiveness in the angle closure glaucoma of lens extraction. That's the important randomized control trial. They have recruited the patients of primary angle closure and primary angle closure glaucoma, and they randomize into the lens extraction versus the AIOC plus medication. They have a good number of patients in the trial recruited. That was 419. PSC were 155 and PACG were 263. They did the follow-up for almost 3 years for this, and they thought that the lens extraction will lower the intraocular pressure, quality of life of the patient will improve, and there will be a reduction in the cost of the treatment versus the laser peripheral iridotomy and topical therapy. So the outcome was that the clear lens extraction was better as compared to the YAG laser iridotomy, but there was only slight difference in IOP reduction in between the two groups, and that is approximately 1 millimeter of mercury. So the lens extraction for angle closure disease, this was the landmark trial, but before that, the first trial was from Eric Graves and his colleagues from Netherlands, and that was based on the result of the ECCE with IOL. But with the phacoemulsification, there were few good trials before the landmark study, that is the Eagle trial. Out of these, the two were from Clement Them and his group, and they compared the clear lens extraction versus the trabeculectomy with phacoemulsification and clear lens extraction versus the trabeculectomy. Let us see that what these trials says. So there is a review article in Survey of Ophthalmology in 2020, and most of the remaining talk is based on this. In this review article, they have taken out all the trials conducted for the on the role of the clear lens extraction or the lens extraction in angle closure disease. But most of the trial have a very low sample size, so the power of study was very poor, and the follow-up is very, very short. None of the trial has a more than 3 years of follow-up. So first, let us discuss about the lens extraction in primary angle closure disease. This was published way back in Journal of Glaucoma in 2006, where they have studied the role of the lens extraction in primary angle closure disease, but all the patients, they had a cataract. The number of patients recruited in this trial were 21, and the follow-up was 1 year. So in primary angle closure glaucoma, with coexisting cataract, the cataract extraction alone by phacoemulsification can significantly reduce the intraocular pressure and the requirement of the anti-glaucoma medication. That was the outcome based on 1 year follow-up. The role of lens extraction in acute angle closure, obviously it's a very difficult and pretty challenging. So in this trial, they have recruited total 37 patients, followed up for 2 years. This was from Tin Ong and his colleagues from Singapore. So the conclusion in this study was, when it is performed within 1 week of acute angle closure, then with the coexisting cataract, then it can reduce the intraocular pressure significantly, and the outcome is better than if you do the laser peripheral iridotomy. Another trial, the phaco versus the laser peripheral iridotomy in acute PSC. The significant greater reduction in IOP when you do the lens extraction, lower rate of IOP failure as compared to the LPI, wider opening of drainage angle, and this study is from Professor Lam et al. Published in Ophthalmology. Clear lens extraction versus trabeculectomy, it's from Clement Them and his colleague, published in Ophthalmology in 2013. Again, the sample size is very small. It's just they recruited 50 patients, followed up for 2 years, and the outcome was what they reported is the clear lens extraction does reduces the intraocular pressure in primary angle closure glaucoma disease, but the trabeculectomy lowers the IOP better, but trabeculectomy is associated with more complication as compared to the lens extraction in primary angle closure glaucoma. This is another study where the phacoemulsification was compared with the peripheral iridotomy in the management of chronic primary angle closure disease. So in this study, they recruited total 13 patients and they followed up for 2 years, and there was a statistical significant reduction in the intraocular pressure. The number of anti-glaucoma medication were also less in the IOL group. So the phacoemulsification with posterior chamber intraocular lens implantation results in a higher anterior chamber depth and the volume and compared to the LPI. Obviously, it is understandable that if the patient has a chronic angle closure glaucoma minded, then the lens extraction obviously would be a better choice as compared to the LPI. This study did not discuss about the trabeculectomy. So there are lots of studies, and these all studies were included in that review article. Obviously, I cannot cover all these studies. So in summary, the lens extraction in angle closure disease changes the morphology of anterior chamber, hence reduces the intraocular pressure. In all stages of angle closure disease, the lens extraction may be effective in reducing the IOP. Important factor to determine the outcome was initial IOP, anterior chamber depth, and lens vault. That is what Dr. Harsh was discussing. The prospective randomized controlled trial with long-term follow-up and adequate sample size can address this issue. Lens extraction for the management of angle closure disease should be considered and done only by those who have experience to deal such kind of surgery. Thank you very much.